This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Have you ever wondered what goes into treating complex hand injuries? Dr. Megan Rudolph, a hand surgeon at Mercy Health, shares common hand conditions, innovative treatments, and what you need to know about recovery.
My name is Megan Rudolph, and I'm a hand surgeon at Mercy Health. Originally, I was inspired to do hand surgery because I treated patients with hand injuries in training, people who had accidents at work or at home, and they would come to the emergency department with these terrible hand injuries, and I was really inspired to be able to help those people get back to their work and their quality of life. Most common problems would be broken bones of the hands and wrists, arthritis of different types, and for people who have numbness of their hands, they might have something called carpal tunnel syndrome or cubital tunnel syndrome. So those are probably the most common things. For things like arthritis, we try things that are not surgery first. So anti-inflammatories, splinting, therapy. And if things get bad and it's affecting their quality of life and their ability to do things they like to do, then we talk about surgery. If they have arthritis or they have a broken bone, we'll certainly get x-rays and take a look at things. If it's other things like fractures or problems with the sensation to the fingers, a lot of that depends on how severe it is. If they've got numbness in the fingers, sometimes they have to get nerve studies. And then just talking to patients, getting a sense of what their symptoms are and their limitations are, and coming up with a plan together. The things that don't involve kind of the bones, like carpal tunnel or trigger finger releases, most people are back to doing their typical activities by 2 to 4 weeks. So it's a relatively short recovery time for that. Other things like fractures might take 4 to 6 weeks. And for some of the more complicated arthritis surgeries, the recovery is a bit longer, closer to 3 months. So I try to encourage my patients and remind them that scarring on the hand and wrist generally does really well. There are a lot of people who they've had, say, a carpal tunnel release 5 years ago and you can barely see the scar. But also if they are having problems and they are concerned about the scar, there's a number of things that we can do for it. We do scar massage, which helps break up the scar and helps it to heal better. And then also working with therapy, they have different kind of treatments that they can do for scarring as well. And that improves the appearance of the scar over time. Our hand therapists help in so many ways. They help get patients moving. They help with scar management like we were talking about. They help with pain. And really they're another provider that can help and listen to patients and provide very useful feedback for how we can give patients the best results. There are a new set of procedures called denervation procedures. So these new procedures basically remove the nerves to the joints so that the pain around the joint is improved, but the recovery time is actually quite short. It's a new area of hand surgery that can offer patients pain improvement without the long recovery that other surgeries might require. There are a lot of things in hand surgery that are more easily addressed if we find it early, and the outcomes are generally better if we find and treat it early, as opposed to if it gets put off for a while, it becomes a much harder problem to deal with. So I would say if you are hesitant about coming in to see a hand surgeon or to get treatment for your hands, just make an appointment and we'll talk about it and we'll find a plan that's best for you.